Good afternoon. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk to you a little more about expansion in the dental arches of older people. I mean, for a time we thought you couldn't do this. You couldn't expand their arches. You couldn't do orthodontics on them, but that is not right. You can expand these arches. I really feel like you could do it as long as a person is alive if you if you wanted to do that. And so anyway, this is the second case of about 5 that we're going to try to show where we expanded the arches. And I think we do it with nothing but arch wires. We use that big arch wire to do that. And I'll run through it as fast as we can. It's a real nice lady again. We seem to have nothing but nice people over there. And we'll show you her arches, and you look at her facial structure, and you can see, you need something in here. And so we're going to try to fill that out and just round out the whole dental arch in here. And so I'm going to run through it pretty quick. The regular orthodontics we've covered hundreds of times, so you can look at. She's got, looks like it's not a crossbite though, but everything looks pretty good over here, except it's a class 2 on this side. See, actually this molar should be out here somewhere, like that. So we'll see. I don't know whether I corrected that or not, but anyway, let's get into it. The midline is not, it's owned pretty much at the incisal edge, but off further up on the case. Let me see. On this side we've got a crossbite in there with a bicuspid. There's no big deal on this. Now the upper arch is narrow, and it has a big gap in it like here. See, this not over here on this side is pretty good, but we need some more space up here, so we'll just widen this whole thing out, and we'll do it with arch wires. And you can do it with arch wires. The only thing you can expand, and the crowns would go out like this. Well, you want the roots to come out with them, and so you put buccal root torque in the arch, and it'll bring the roots out as it brings the crown out. Excuse me. And you have to do that, of course, in a rectangular arch. You would put this buccal root torque in there. Now the lower arch is the same way. I mean, it comes down, kind of straight in here. We're going to try to round this whole thing out so she'll have a nicer looking smile in this area right here. Now let me go here. All right, here we are in the mouth, and this is 99, 428 of 99, and we're in a kind of a you can see we got a little crossbite up here in the anterior part of the mouth, and over here had that tooth kind of blocked out. And let me just run through the teeth here. The right side in this now is a class 1 relationship. So we've expanded this and moved this back, and so this is in class 1 now at this point. And over here we're in a class 1 relation. We cracked the enamel off of one of these crowns right here. I don't know whether we did that or it was off to start with. This is 4 of 99 now, and we have expanded this upper arch, and you remember what it was like to start with back there. Now the lower arch, done the same thing, and she had some crowns built over here, and we bonded this on, and so we're right here in the middle of this case. Now here's what it looked like prior to that. You can see the uh, caved in area in this portion right here. Let's see, well, there we go. I'll have to go back and get a little arrow on this deal. There we go. And we got this, and you see how we expanded this out now. So we showed you the expansion really before I showed you what it needed to be done. Now here's kind of what we did. We just we leveled everything out with a regular arch wire, but I put one of those big heavy wires in. You can expand it like that, and they'll expand almost anything you can put them on. But you just carry the crowns out if you aren't careful and know how to put this buccal root torque in the bicuspids and even the cuspids and some of the molars too, as you go back, so that the crowns don't just go out this way. You bring the roots out with the crowns, and you put the torque. Now you've got a rectangular slot in there, and you want this arch wire to force this tooth out this way. So you put this buccal root torque in it, and you bend this up and stick it into the slot of the tooth, and it will bring the root out like that. But it tends to push the arch wire in if you don't have some substantial force out there holding it out. So the large arch wire does that. I mean, it gives you all the force that you need and push it out this way. And so when the buccal root torque tends to bring the crowns in instead of the roots out to the sides, because the roots are sticking up here in the bone and they're harder to move. And if you just put the buccal root torque in a rectangular wire back here, it'll bring the crown in further, you see. And so you need to have the substantial force out here, and then as it tries to push the crown in, it brings the roots out, and that's what we're after. And so you can expand just darn near anybody. I've not run into anybody we couldn't expand, and so that sounds bad, but if they've got good bone structure on the roots, you can do it, and I will show you the x-rays on this. Well, here I didn't remember whether I had a picture of this large arch wire or not in there, but here it is, and this looks like either an 036 wire or 040. Probably it's an 040, and you're very careful. You just expand it out somewhere like this, and you have both sides, and you pull one side in and tie it, and then this one will be sticking way out over here. Push it in and tie it in there, and that's spreading this whole thing out. But it's just carrying the crowns out. That's what I have to get. So it's just leaning them out this way. Now to get the roots out here, you come in after you get this lined up good and put a rectangular wire in there that has this torque in it. Now let's see. No, I'm sorry. You have to put the thing in with a torque that is going down like this. And so you raise it up and insert it into that slot, and it tends to move back like that, and it'll move the roots of the teeth out. Sometimes you have to think about it, you want to get it down here, and so that the arch wire is pulling on it. Then when you get them where you want it, you need to take that out or get out of the arch wire and finish it, because it'll just keep pulling them on over and over until it gets to where it's passive in there. Now, you can't depend on the slot of the bracket to do what you want it to do. As you get closer to correct with the bracket, the force gets less and less and less until you almost have no force when you get where you want to, unless you put a lot of extra torque in there, you can make those teeth move over and pull out, bring those roots over good. And then when you get them where you want them, you take that torque out, see. Okay, let's go on to the next. We did the same thing. So here the arch is with the big arch wire in there, and this is just a round wire now. So you've got to remember, you got to come back and put a rectangular wire in there, or these crowns of these teeth will be leaning, and the root will be up in here, and you want that root straight up above that tooth, and that enlarges your airway and everything, and that's why naturally it would work that way. Here we had a bridge, and we just bonded this bracket onto a bridge, and it'll do the same thing. You'll do the same thing with the bridge that you do with a single tooth. You just have a tooth that it looks like it's got two legs out here, kind of like a table, and you work with it, but you just need one bracket on the bridge, and that's what we bonded on there. Now we're finishing this thing up, and we do the rest of the touch-up orthodontics, and it's in a rectangular wire. Now if you notice, this is a rectangular wire. It's good to put the rectangular wire on before you stop using the large arch wire, so it supports the teeth, keeps them out. Now this rectangular wire here, you could have it almost straight out here, but a lot of times it doesn't have enough buccal force to bring the roots through the bone and carry them out there. The torque has enough force in it to do that. Okay, here we are. Now you can see the rectangular wire in there. We probably expanded that as we put it in, and we went through here. The model when we started, you see this is class 2, and we're head on straight. You got that. I think we showed these to start with. In this bicuspid, you got rotations, and you'll have all kinds of things with adults. You'll have temporomandibular joint problems, and you get into really involved cases in here. Now you watch when we finish this out. This will be kind of coming out some here and coming back in this direction, and the smile will be a lot better when you get through. Okay, here is the first X-ray I think that we've got on this, and this lady's 60 years old, and this was in 91 right here when we did that, and she had lost a looks like a 6-year molar out there, and she had one out here. Now normally if we had done this, these roots would be down here, but I didn't want to tear up this bridge, you know, just to straighten this tooth out and have her put another one. Or if we had gotten to them before they had the wisdom tooth out, now we might have done that. In other words, we could have moved this tooth up here and brought the wisdom tooth back in there. And we could take these two teeth and move them forward, which we probably did some of that. We'll have to look at the other panorexes and see. Okay, that's the first panorex. Here's the second one. You see these roots are straight up and down now. That one is not. And we didn't do anything but just move this whole bridge forward. We didn't try to change the bridge, you know, so the teeth are going out, which I don't like, but it was already that way, and I don't want to tear it up just to get it it's like I wanted it. All right, here is that bridge in the mouth, and so we let this tooth fit into the center and left a space in that area right there. So we had something to fit behind. Now down on the bottom, there's the lower bridge, and this tooth right here will be rotated back. I hope that we did that. I think we certainly would try to do it. How it is, it's turned around right here. This is turned properly. So we saw it. Sometimes I'm showing something and I didn't catch it when I was doing it, and you catch it when you're showing it to people. Now we're rotating with this elastic chain. It's tied out here, wrapped around that tooth, hooked onto the bracket, but not over the arch wire, and it'll turn that tooth like mad. There's nothing I know of that'll rotate as good as, and we've got a video or two on rotating the teeth like that. If you don't know how to do that, you ought to learn how to get in there and do that. Okay, now here's the large arch wire up there. Let me see. And I think we had a round wire when I first looked at it underneath there. This is rotated good now from the side. Now, this tooth does not have enough buccal root torque in it, and so I really should bring those roots out further. This crown ought to be down lower in here, and I'm not sure I did that, but that's what I should have done if I didn't do it. Okay, and it looks pretty good now, so we must have come in there and brought the roots of that tooth out. Now, here's another thing we do on adults. We run these, this is a pretty good example of carrying these brackets down low and then coming back up higher in here. And the person will hardly see these brackets, and you put the plastic or ceramic or whatever you want up here, and they don't see that as much. They will see this, of course, the arch wire, but down here they won't see anything unless they really show their lower lip, which rarely do, especially women, show their lower lip when they talk. Some people do. Okay, now here we've finished it apparently, and it looks quite good. And we look at it from the front. This midline's off a little bit, but there may be some discrepancy in the size of the upper teeth. We don't have the crossbite back here, and she's done some bridge work to fix them up prettier. That's really something wrong here. She may come in and have to do that. I don't think we broke that off. It just wasn't very secure when we started. Okay, now that's finished out, and we notice we've got a nice even curvature that fits the tongue good, and when you smile you see teeth back here like that. And so we'll go ahead, and we've lined up the bottom and put a good 3-to-3 retainer on the bottom. This tooth is rotated good, and this looks good on that bridge. Alright, here's the Panorex after we, this is 92, I guess this is pretty well, we are still in the braces though. Now here's the next Panorex, and we've taken, I believe, everything off. This is the 3-to-3 coming across here. This is the bridge. This is in class 1 relation here. Looks good. Now here's the lady's facial structure at just almost a perfect vertical height of the face, because she had a good height to start with, and we didn't molest it. And here she's got a good facial structure from the anterior, and I think her smile line is excellent. You just see the top of the teeth and very little gum tissue in there, and then you see teeth all the way back in these corners right here, see? And that makes the smile much nicer. And so here is the profile from the side, and that ends this video. And I hope you watch these. I'm going to put 3 more of these up where we've expanded adults. And I know this lady, and I'm sure she's still got that. She uses a retainer maybe at night or something like that. But they can have those teeth the day they pass on, you know. And so I recommend doing this on adults. More adults need to have orthodontics, and I think the really university-trained orthodontics should get into this adult stuff. And it may have TMJ problems. It may have all kinds of teeth that are out, and root canals and cysts, and anything you mix, it's going to throw it in there. So you have to really think about the case when you start out like that. But this is a good thing to do, and I'm going to close out and say thank you for watching it, and I hope you'll join our group and subscribe to our videos. We'd like to have you in the group.